Chiropractic is not an alternative healthcare to medicine.
It's not alternative.
It is not. If you say something is alternative, you are talking about, let's say if you had aspirin and then you have diclofenac, they do the same things, and so you can decide to choose one or the other.
Right.
These are two very, very different things. And to begin with, you shouldn't compare it, because one is approaching healthcare in the form of the effect of whatever thing that may have caused their problem. One is treating the symptoms of problems, and another is treating the cause of the problem.
So you're saying that medicine treats symptoms,
yes,
and chiropractic gets to the cause
of the problem. Now, for example, if you didn't have a headache, you wouldn't have any reason to take your paracetamol or your Advil or whatever medication you're taking. Okay. Now, with chiropractic, if you are well thought enough to know, you didn't have to have a headache to get an adjustment done, because what you are doing really is realigning your spine so your body can take care of yourself.
You say realigning the spine?
Yes. This here is a typical spine. It should have a curvature in here and then a good curvature there. Now, due to some kind of stress, could be physical, could be chemical, could be emotional. Physical stress is, for example, a car accident, a fall, an injury. It can cause some of these bones to be misaligned. I mean, they can basically get out of line from being in the center when you look at it from the end, from back to front, to being on the side, maybe like that. Now, this here is what we call vertebral subluxation complex.
Vertebral subluxation?
Yes. Now, basically, what this means is that the bone here has misaligned enough to put pressure on the nerves, which will be coming from the sides of the bones there. Now, let me take you through a little bit of anatomy. When you see the spine here is housing your lifeline, which is your spinal cord. This here, the spinal cord itself, is actually from right on top here. Your brain sits here, which is controlling your body functions. The brain itself comes down to become your spinal cord. Now, that spinal cord will go through all the way here to the very, 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 very end. The spinal cord would exit in the form of your spinal nerves from the sides of your spine. So if we go back to what I was talking about earlier, if you have misaligned vertebrae like this, then of course that spinal cord, which is exiting from here, is going to get some kind of pressure on it. When you look at it from here, you can tell there's a difference there. There's a little bit of a shift to one side. Now, what chiropractors do is not to heal your headache, your lower back pain, or anything like that per se, but to get at your problem from the root cause of it. Now, no amount of paracetamol or no amount of Advil or diclofenac will move this bone here to the spot where it was before. So you need somebody with the knowledge to do this, which is a good chiropractor, who will bring this bone back into place, and over time, this here would get along properly, and then there will be space for the nerves to come out from here. So basically, if you should have any subluxations in your spine, then a chiropractor is the best person to take care of that particular problem for you there. Now,
so subluxations can produce health problems.
Sure.
I was just looking at your chart over here. Mm-hmm. Can you just explain this to me?
Yes.
I see that, for example, the heart gets a nerve supply from over there in the spine.
Yeah.
And if we have a look at the actual model, where exactly is that?
Now, this here is your cervical. That's in the neck area. We have 7 bones for that. And then we have your thoracics, which is all the way down here, and then your lumbars. Now, the thoracics, for example, the nerves coming from here control stuff like your heart, your lung, your stomach,
all
of
the
that.
organs are supplied with life force from the spine.
By all means, because you see, as your body works, unless you have nerve, it's like your telephone wires of the body. Your brain is controlling your body, and it's doing that through these nerves. So if these nerves are not working properly, then your body will not work properly, no matter how hard you try.
Right.
Because basically, if I need to communicate to the person next door, and we don't have any kind of communication through the telephone or whichever medium that we have to use, then of course the person won't hear me. What would be the use of me talking to you like? That's like 20% of my talking is wasted.
So
or maybe
the subluxations interfere with the quality of the nerve impulse.
Exactly.
And is it true that the nerve impulse travels through an electrolyte?
It is true.
It doesn't travel through the nerve itself, it travels through the electrode, and the electrode is composed of tissue salts.
Yes.
And alcohol depletes that.
It's true.
That's why a lot of people that use excessive amounts of alcohol will have all kinds of health problems because
exactly.
the nerves are being depleted of the electrolytes.
Yes.
Is that true?